Hello, good day everyone. So this would serve as our pre-recorded video for the discussion on your lesson 3. So we've already discussed the lesson 1, which is Introduction to Human Anatomy and Physiology, and lesson 2, which is the classification of or levels of organization. So today, we will be discussing the lesson 3, which is entitled about terminologies and general plan of the body. So before we will be going to the discussion, let's know first the objectives or the goals in this topic. So may I show to you the first objectives would be at the end of my discussion, my students, you guys will illustrate the different terminology and general plan body that includes body parts and areas, terms of location and position. Aside from that, you will be also know or explain the body cavities, membranes, planes, and section of the human body. So that was the main goal or our main objectives for the topic today. So let's start by terminology and general plan of the body, particularly in the terms of location and position. Let's start on the illustration. So this would be the illustration of your body parts and areas. So I will be giving to you, or I will be giving you the terminology and the definition of it. So the terminology, this is actually the list of the parts and areas in our body. So, aside from terminology, of course, in the terminology, may definition din siya. Ano yun? We have the term antebrachial or antebrachial, which is refers to forearm. Antecubital, which refers to your front of elbow. Axillary, which refers to your armpit. Brachial refers to your upper arm. Buccal, which is oral, refers to your mouth. Cardiac, which is your heart. Cervical, your neck. Cranial, your head. Cutaneous, your skin. Deltoid, your shoulder. Femoral, your thigh. Frontal, your forehead. Gastric, your stomach. Gluteal refers to buttocks, to your buttocks. Hepatic refers to liver. Iliac refers to hip. Inguinal refers to groin. And we have lumbar refers to small of back. So this terminology and definition, you will be familiarizing or memorizing these terms. So later on, I will be showing to you guys what are those or saan ba nakalocate yung different terms na ito, kung saan natin siya makikita sa parts of our body. So I will be showing to you an illustration again that shows the location of the different parts and areas. Okay, let's proceed to another slide. Other than those terminology, we also have mammary, refers to breast. Nasal refers to your nose. Occipital refers to your back of head. Orbital refers to your eye. Parietal refers to your crown of head. Patellar refers to your kneecap. Pectoral refers to your chest. Pedal refers to your foot. Perennial refers to the pelvic floor. Plantar refers to your sole of foot. Popliteal refers to the back of knee. Pulmonary refers to your lungs. Renal refers to your kidney. Sacral refers to your base of spine. Scapular refers to your shoulder blade. Sternal refers to your breastbone. Temporal refers to your side of head. Umbilical refers to your navel. And volar or the palmar refers to your palm. Okay? So this time, I will be showing to you the location of different terminologies and its definition. So I have here the location or the body parts and particularly the areas of those terminology. So as you can see, this illustration shows the different on how can you locate the different parts of the body. So we have here the anterior and posterior. Let me explain it to the next illustration kasi ito mas visualize. Okay? So as you can see in this illustration, we have anterior. When we say anterior, it is focused on the front parts of your body. When we say posterior, it is in your back of the body, okay? Back parts of your body. So what are those anterior parts or front parts in your body? We have orbital, nasal, oral, cervical, buccal, sternal, acromial, axillary, thoracic, brachial, antecubital, abdominal, umbilical, corporal. This in your palm, pelvic, digital, this your fingers, pubic hair, of course your pubic, causal, inguinal, femoral, patellar, fibular, crular or your leg part, tarsal, and the tarsal. Okay, so that was your anterior parts. So those parts, you can locate those parts in the front part of your body. So how about the back, ma'am? Back stands for posterior. If you're looking for the back part, you're looking for posterior part. So what are those posterior part? We have cephalic, or the side of your head. We have occipital, deltoid, scapular, vertebral, lumbar, sacral, gluteal or your buttocks. We have femoral also, popliteal, and soral. So that was the anterior and posterior of your body. So as you can see in the illustration, you will know now the location of different parts. So comparing it to another illustration like this one, parehas lang. Actually, it is the same to this illustration. Ito lang classify lang niya the anterior and posterior. Unlike this one, parehas lang din, pero the differences is this one naka-indicate talaga is the anterior part and the posterior part. So that was the body parts and areas of your body. So I want you to familiarize and memorize it because this is very important. I will be giving you an activity about this. So probably this activity would leads to after the exam na lang. I will be giving you as a part of the activity for prelim is to memorize or to you have to make a video presentation about yourself, memorizing or familiarizing your body parts and area, including the location. Okay? So let's proceed now to, of course, check your understanding. So this time, since it is pre-recorded discussion, so probably you will be listening it afterwards. Or probably you will be listening it tomorrow o mamayang gabi. So what will you do is that I will be giving you some question here so that I can check your understanding. So how can you answer it? You can pass it to our GC. You can send it to our GC after you listen the discussion. So afterwards na lang, once you've listened it, like for example, later on, mamaya pagbigay ko, mapapakinggan nyo na agad, you can answer it immediately and send it to our GC. So again, you will be sending your answer in our GC no PM. Sa GC lang para isahan lang yung pag-check ni ma'am. Okay? So let's proceed on the checking your understanding. So I will be giving you some terminology, then you will be giving me the definition. Once I will give you the definition, you will be giving me the terminology. So let's check. So for the first question, give me the terminologies of this give me the definition of this different terminology. We have cranial, next gluteal, next iliac, next lumbar, next and brachial. Okay, so what will you do? Your answer would be the definition of this different terminology. Okay? I already discussed that one kanina. Yung pinakita ko na illustration, nandun lahat. So once you've already familiarized or once you've already listened to that first discussion, malalaman nyo ano ang definition ng cranial, ano ang definition ng gluteal, ano ang definition ng iliac, lumbar, and brachial. So that's it. So you will be giving me the definition. So the next one is you will be giving me the terms. Give me the terminology of heart, thigh, liver, front of elbow, and forehead. So again, in this part, give me the terminology. Terminology ang inihingi ko sa part na to. For the first part, give me the definition. So this time, give me the terminology of heart, thigh, liver, front of elbow, and forehead. Okay, hindi pa dyan natatapos. We also have, give me the terminology pa rin, foot, breastbone, kneecap, base of spine, and breast. So you will be giving me the terminology for foot, breastbone, kneecap, base of spine, and breast. Okay. So another part, give me the definition naman. We have orbital, sternal, umbilical, and plantar, and lastly, pulmonary. Okay, for the last part, you will be giving me the definition. For the first part of this slide, you will be giving me the terminology. Okay, naintindihan? So I will be expecting your answer in our GC. So let's proceed. So now let's proceed to our topic, which is terms of location and position. Okay. Sorry. So, for terms and location of this position, I will be giving you the terminology, and you will be creating or making it to a phrase. So, let's, for example, we have different term and different definition. We have terminology: superior, inferior, anterior, posterior, ventral, dorsal, medial, lateral, internal, external, superficial, deep, central, peripheral, proximal, distal, parietal, and visceral. Okay, so this terminology, you can create or make it to phrase in accordance to the different parts and areas. So what are the definition for these terms? We have superior, above or higher, inferior, below or lower, anterior, toward the front, posterior, toward the back. It is the same to dorsal, okay? Ventral, toward the front. For the highlighted terminology, it is the same. For anterior and ventral, it is the same, that it is toward the front. For posterior and dorsal, it is the same, that it is toward the back. Medial, we have toward the middle or the midline. Lateral, away from the midline. Internal, within or interior. 2. External, we have outside or exterior. Superficial, we have toward the surface. Deep, within or interior 2. Central, we have the main part. Peripheral, we have extending from the main part. Proximal, closer to the origin, and distal, farther from the origin. So, I have example here. So, I have example for the different terms and its definition. So, I will be giving the body parts, including its term for the areas and location and position. Like, for example, for the superior, example, the heart is superior to the liver. Meaning to say, the heart is above or higher to the liver. So, meaning to say, like for example here, I will be standing my heart, this is your heart, then this is your liver. Okay, so as you can see, this is your liver, and this is your heart. So literally, your heart is above than your liver, or your heart is higher than your liver. Position now, we're talking about the position. The heart is higher to the liver, or heart is superior to the liver. Okay, naintindihan? Next, we have inferior. For the inferior, the liver is inferior to the lungs. Meaning to say, the liver is below or lower to the lungs. Okay, so meaning to say, your liver, yung liver natin which is nandito, is lower to our lungs. Because this is our lungs. This one. Okay, so again, your liver is below or lower than your lungs. So you can visualize it in the areas or in the illustration that the position of the liver is in the lower part of your lungs. Okay, for another term, we have anterior. For anterior naman, it's said toward the front. So for example, the chest is on the anterior side of the body. Okay, the chest is on toward the front side of the body. So where is your chest? So meaning to say with anterior, meaning to say the parts is in the front. So this is your chest. So that is why it said that the chest, your chest is on the anterior side. Meaning to say this one, this is your chest, the side of the front part. Okay. Yan ha. Again, when we say anterior, nasa harapan na body part. So when it said harapan, those parts na location niya nasa harapan, hindi nasa likod. Okay, anterior, your chest is on the anterior side of the body. Side by side, this is your chest. Okay? Naintindihan? So let's proceed to posterior. It is very contradict or very contrast to anterior. Why? Because anterior is in front and posterior is in the back. So for posterior, we have the lumbar area is posterior to the umbilical area. So where is your lumbar? Okay, meaning to say that your lumbar area is your small of back, or in this one, in this area, and your umbilical is this one, your navel. Okay. Yung pusod mo. Okay. So the lumbar area is the small of back sa likod, and your umbilical is the navel. So the term would be posterior. Why? Because the lumbar area, tama, yung lumbar naman is located in posterior. So it said the lumbar area is posterior to the umbilical area. Okay? So naintindihan? So meaning to say the lumbar area is toward the back of your umbilical area. So next to posterior, we have ventral. As I've said, all the highlighted part is the same definition. We have anterior, the same with ventral, and we have posterior, the same with dorsal. For the ventral, it is toward the front again. So the mammary area is on the ventral side of the body. So meaning to say, the breast part of a woman, not only in the woman, because man also has a breast. So the breast part of it, or the mammary part, so the breast part would be in the front. So as I've said, when we say ventral or anterior, those parts that is in the front. Okay, so it said that the mammary area or the breast part area is toward the front side of the body. So meaning to say, side by side in the front is location of the mammary or the breast. Okay? Next, we have dorsal. Dorsal is toward the back again. For dorsal is the buttocks are on the dorsal side of the body. Or your gluteal for the term. Your gluteal is on the dorsal, meaning to say towards the back, nasa likod. And gluteal is also located side by side. So meaning to say towards the buttocks are on the dorsal side, or towards the back, side by side of the body. So that was the gluteal or the buttocks. Next, we have medial. It's very simple because when I say medial, it is toward the midline. So the example would be the heart is medial to the lungs. So of course, kaya nga sinabi ko, this is your heart, and in your heart is the middle, and the side by side of it is your lungs. That is why it said the heart is medial to the lungs. Next, we have lateral, away from the midline. So if the medial is in the midline, toward the midline, lateral is away from the midline. So the example would be, the shoulders are lateral to the neck. So meaning away from the midline. Since the neck is your center, the neck is your middle, so your shoulder will be your lateral. So meaning to say, neck is very away from the shoulder. Okay, or your shoulder is very or away from the neck, which is your neck is the midline. Okay, so next we have internal. Internal is within or interior to. So meaning to say the brain is internal to the skull. Yes, it is actually correct. Because before you can see the brain, you will first see the skull. So meaning to say the inside of the skull is your brain. So that's why it said the interior or within, nasa loob or inside. It is very contrast to external. Why? For the external naman is labas, nasa labas, outside. Outside or exterior too. So the best example would be the ribs or external to the lungs. Yes. Before you can locate your lungs, you will be locating first your ribs. Okay, you will be looking first your ribs. So as I've said, ribs will serve as the protection of your lungs. So before lungs, you can see the ribs. That's why it is exterior, external, or that's why it's said external to the lungs. So meaning to say, nasa labas, the location of the ribs is outside of your lungs. Okay? Next to that, we have superficial. For superficial naman, it is surface. So meaning to say, nakikita lang sa surface yung part na ito. Ano pa ba yon? Of course, it's very understandable. It's very obvious that the surface part of our body is our skin. So skin is the surface part of your body. Okay? Next to that, we have deep or within or interior too. So the deep veins of the legs are surrounded by muscle. So yes, before you can actually, or in a muscle, you can eventually look for, or you can eventually see the veins, di ba? Within, nasa loob, or kaakibat. Yan yung best way. Kaakibat ng muscle, yung veins, nakikita na sa muscle, sa pagpakita pa lang sa illustration ng muscle, nakikita mo yung veins. So that's why it is deep. Parang na-implant na sa kanya. Okay? Next, we have central. For the central, it is the main part. Okay, the main part. So the example would be the brain is part of the central nervous system. Yes, the main part of the nervous system is of course the brain. Okay? Then peripheral, extending from the main part. So nerves, so aside from the main part which is brain, we have peripheral. Nerves in the arm are part of the peripheral nervous system. Okay, so meaning to say, brain is the main part of the nervous system, but the extended part, main part of the nervous system is the nerve. So that's why it's called peripheral. That is why nerves, we can use term peripheral for the location. Okay? So let's proceed to proximal. For proximal naman, the knee, let me zoom it so that you can read. The knee, proximal. The knee is proximal to the foot, meaning closer to the origin. Tama. It is closer to your foot, or your knee is closer to your foot. Okay? So we have another distal, further from the origin. If proximal is closer to the origin, distal is farther from the origin. So your palm, is distal to your elbow. Yes, it's very far away from the origin. This is your palm, and this is your elbow. It's very away. Palm is distal to your elbow. Okay, very far away, farther from the origin. So next, we have parietal. We have parietal pertaining to the wall of a cavity. So parietal pleura lines the chest cavity. So you can actually see that illustration in the cavities. So meaning to say, when I say parietal, it is the wall of a cavity. So lastly, we have visceral pertaining to the organs within a cavity. So visceral, the visceral pleura covers the lungs. So I will be showing to you that in the lecture, which is cavities. Okay? So again, you can actually shown, or I can give you the illustration in the membranes or the cavity for the parietal and visceral. Okay? So let's proceed. I hope you've already understand the different terms location and position. So yung kanina, body parts, which is in the terminologies and definition yon. Ito naman yung location. So how can you know the location of the heart, or how can you know the location of the liver, like that? So from the term and definition. So let's proceed to another slide. So let me check your understanding. If you can answer true or false for this. Okay. So it is the same for the first part that I gave you an check understanding. For the first part, it is the same. You can answer it in our GC. So after you will listen to my discussion, you will answer it, or you will give me the answer to our GC. Okay? So let's proceed to the question. So true or false? The scapular is on the dorsal side of the body. So it is true or false? Next, the deltoid is superior to the occipital. Okay, it is true or false? Next, the sternal area is on ventral side of the body. Okay, it is true or false? Next, the antecubital is inferior to the antebrachial. So you will be answering if it is true or false. Next, we have the lumbar area is on the anterior side of the body. True or false? Next, we have the patellar is proximal to the pedal. True or false? We have the pulmonary or external to the ribs. True or false? And for this question, the groin is lateral to the umbilical. Lateral. Okay. True or false? And another, the epidermis and dermis are superficial organ. So what do you mean by superficial again? So I've already discussed that one. Okay. True or false? And that's it. So you will be answering, or you will be giving me your answer in our GC. So after you listen this discussion. Okay? Okay? So now let's proceed to another topic that we'll be discussing for this day. So let's proceed to body cavities and their membranes. So let's define first what is body cavities. So body cavities are internal chambers holding vital organs, or when we say body cavities, it is actually space or any space, compartment or potential space inside of the body. So that was the body cavities, and body cavities is actually separated by a membranes called actually, we have two major dorsal and ventral cavities. So let's go back. So aside from that, the function of body cavities is, the major function would be the protection. So cavities protect vital organs, and cavities allow organs to change in shape and size. Okay. So again, let me repeat. When we say body cavities, it is internal chambers, or it is any space or compartment. Okay, so in the inside of the body, those compartment or those space inside the body is your body cavities. That space or that chambers is actually holding the vital organs. And what is the main function or the main definition of it? The cavities will protect your vital organs, and the cavities allow organs to change in shape and size. So again, kanina sinabi ko, body cavities is separated into two membranes or into two cavities. We have dorsal cavity, which is posterior or toward the back, and ventral cavity, which is anterior, which is toward the front. So kanina nga, we've actually discussed the location and the areas and the position of the different parts. So it is the same with the anterior and posterior. Kaya nga I highlighted the part in the illustration that it is the same definition. So for the dorsal, it is the same to the posterior, which is toward the back, and for the ventral, which is the same with the anterior, which is toward the front. Okay? let's discuss this furthermore. So this was the illustration of the cranial, of the dorsal cavity or the posterior part, and the ventral cavity or the anterior part. Okay, let's discuss it one by one. So let's first discuss the dorsal cavity. So for the dorsal cavity, it contains the central nervous system. Okay, why? Because as I've said, dorsal is your posterior, and meaning to say it is in the toward the back of your body, the parts that you will be looking, or the parts that is located, one of those is the nervous system. So that is why dorsal cavity contains the central nervous system. Next, what are those? We have the two type of cavity, which is in the dorsal. We have the cranial cavity, particularly toward the back, your skull and your brain. Vertebral or your spinal cavity. What are those? We have your backbone and your spinal cord. Ayan, dyan. May illustrate mo yan doon sa illustration na pinakita ko kanina na sa posterior. What are those parts that is in the posterior? So again, for the vertebral or the spinal cavity, you can see the parts which is backbone and your spinal cord. Okay? So you can illustrate that one, or you can visualize that one in my illustration kanina. Okay, let's proceed. So the membranes that line this cavity and cover the brain and spinal cord are called the meninges. So what are the illustration of the meninges? This one. So meninges is actually the cover of the brain and the spinal cord. As you can see, the line or the layer, this one, particularly this one, that is your meninges. This is the blue one. Okay, so that was your meninges. Okay, so for the brain, as you can see, right, that. Okay, as you can see in the brain is the inside part, or brain is the interior part of the meninges. So meaning inside part of the layer of the meninges, diba? Like this layer, yung arrow na yan, that is the meninges. Okay? So, let's proceed to another slide. So, we've already done discussing the dorsal cavity. Let's go now to the ventral cavity. If the dorsal is in the posterior, the ventral is in the front. Okay? Consists of two compartments. We have thoracic cavity, which is particularly in the front part of the body, and we have the abdominal cavity. For the thoracic cavity, we have heart and lungs. The abdominal cavity, we have the stomach, liver, spleen, intestine. Okay, so which are separated by the diaphragm. So that was the ventral cavity. Yan. So, ganyan lang. How can you differentiate between ventral and dorsal? Dorsal are those cavity that is in the back, and ventral is those cavity that is in the front. Okay? So, that cavity consists of two compartments or two division. For the dorsal, we have cranial cavity and the vertebral spinal cavity. And for the ventral, we have thoracic and abdominal cavity. So always remember that one, that the two cavities has its subdivision or compartments. Okay? So let's proceed. Let's proceed to pelvic cavity. Pelvic, if ventral is in the front part and the dorsal is in the back part, pelvic is in the inferior to the abdominal cavity. When we say inferior, inside the abdominal cavity. So let's proceed. So within the pelvic cavity are the urinary bladder and reproductive organs such as uterus in women and prostate gland in men. So you can see the pelvic cavity on inferior or inside the abdominal cavity, and within or sa loob ng pelvic cavity, you can see the urinary bladder or the reproductive organs such as uterus for the women and prostate gland for the men. So we will be literally discussing that one in the reproductive system. So much for the deeper explanation. Okay? So let's proceed. So this is actually the illustration of how can you locate the cranial cavity, vertebral, thoracic cavity, pelvic cavity. This first view is actually the mid-sagittal view. Sorry with the pronunciation. Mid-sagittal view, meaning to say the illustration is in the middle part, nakatagilid. Mid-sagittal view. So, sa gilid niya, you can eventually saw the cranial cavity, vertebral canal, thoracic cavity, diaphragm, and so on and so forth. So, for the coronal or the frontal view, you can see also, oh my god. Okay, so for the coronal view or the frontal view, you can see the different parts again. So just actually, I'm actually showing to you the parts in mid-sagittal view and the frontal view. Okay, so much for that. Let's proceed to another illustration. We also have the body cavities lateral view or the left side of it. Okay, so this was it. Ito yon. So we have cranial, another. You can locate the different, or you can saw the different part of the cavity. Cranial, dorsal cavity, particularly what are those parts? Cranial cavity, foramen magnum, and spinal cavity. For the ventral cavity, we have thoracic cavity, diaphragm, abdominal cavity, and pelvic cavity. As I've said, pelvic cavity is includes in the ventral cavity or in the front cavity kasi nasa front pa rin si pelvic. Okay, so for that we also have symphysis, pubis, and sacral promontory. Okay, sacral promontory. Okay, palaki natin para makita. Okay, so that was the different cavities inside our body. So this is actually the lateral or the left side view of the body. Okay. Okay, so now we've already done discussing the cavities. So let me discuss now the other membranes inside your body. So let's first discuss the pleural membranes. So the membranes of the thoracic cavity are serous membranes. So serous membranes is called as the pleural membranes. So this is actually the illustration of the pleural membranes. So let me correct the pronunciation. It is not serous. It's serous membranes called as the pleural membranes. So what are those? Those membranes? So meaning to say, pleural membranes can be located in thoracic cavity. So those membranes that is actually in the thoracic cavity is called pleural membranes. And the description of pleural membranes is a thin layer that reduces friction between the lungs and the inside of the chest wall during breathing. So that is the main function of pleural membranes. So again, for the pleural membranes, it is located to thoracic cavity, or in thoracic cavity. The membranes that you can actually see is the pleural membrane. So the major function of it is actually to reduce the friction between the lungs and the inside of the chest wall during breathing. So that is pleural membrane. So let's proceed to another membrane. We also have, of course, if we have a membrane in thoracic cavity, we also have a membrane in the heart. So what do you call? The heart has its own set of serous membranes. And what is this one? It is called as pericardial membrane. So it is heart. So eventually you can see the differences of the name. You can eventually know that that one is the part of our heart kasi may cardial. Okay, so as we all know that heart is part of a cardiac system, so eventually the membranes that you can see or you can found in heart is the pericardial membranes. Okay, so let me show you the illustration. So as you can see, yan, ito that one. Let me zoom it. Okay, so that was your pericardial fluid, and this is your pericardial membranes. Okay, so you can eventually saw the different parts of the pericardial membranes. We have pericardium. Yeah, so we will be discussing that furthermore. In the heart or in the cardiac system, which is, we will be discussing also the membranes in each system. Okay, so let's proceed. If we have in the heart and we have in the thoracic, also we have in the abdominal wall. So the peritoneum is a serous membrane that lines the entire abdominal wall. So let me give you an example. So there are two divisions for peritoneum. We have parietal peritoneum and visceral peritoneum. Okay, for parietal, when we say parietal is the outer part or the outer layer which adheres to the anterior and posterior abdominal, as you can see this one. And for the visceral, if parietal is outer, the visceral is inner layer which lines the abdominal organ. So yung nasa loob, yun po si visceral peritoneum, and yung nasa labas po, ayun po si parietal peritoneum. As I've said, again, peritoneum is the membrane line in the entire abdominal wall. Okay, it have two division. We have the parietal, which is the outer layer, and we have the visceral, which is the inner layer lines of the abdominal wall. Okay, so let's proceed to another slide. Any questions, clarifications? If you have questions and clarification, you can eventually ask me in our GC, or you can PM me directly for the for you to be entertained fast. So PM, or even though in GC it's okay. Okay, let's proceed. Okay, so let's proceed now to the body planes and section. Okay, I think this is the last part of the topic for today, the body planes and section. So we've already discussed the cavities inside the body. We've already discussed the body areas, parts, the terminology of it and its definition. We also discussed the location and position of the body parts, which is the superior, anterior, posterior, ventral, dorsal, medial, like that. So on and so forth. So to those questions that I've actually given to you, please please give it to give me that in our GC, to our GC. Okay, let's proceed. So plane. So let's discuss first what is the definition of plane. So plane is an imaginary flat surface that separates two portions of the body or an organ. So meaning to say, plane is actually the separation part of the different organ and the different body organ inside our body. So let us explain it further. So the plane is actually divided into three planes, three sections. We have sagittal plane, we have coronal plane, and we have transverse plane. Okay, so let me explain that one to you one by one. So let's explain first the frontal. For the frontal plane, or it is called as coronal section, it is a plane from side to side, separates the body into front and back portion. Let me illustrate to you that, like that. So this area, this plane section of it, this is coronal. So meaning to say, the coronal plane separates your front part, okay, front and back portion. So meaning to say, the coronal plane is this side, the middle one. So meaning to say, the separation is from the front and to the back. Okay, so that is the separation of coronal plane. So while sagittal section, it is a plane from front to back, separates the body into right and left portion. Let me illustrate to you that furthermore. Okay, so if the coronal is in this one, this one, because it is separation of front and back, sagittal is this one. Meaning to say, it will be separating your right and left portion. So meaning to say, you will be separating your right and your left portion. Okay? So dito si sagittal, separating the right and left portion. While coronal is dito, separating the front and the back. Okay? Sige. Let's proceed to another. If sagittal is in this part, because you will be separating the right and the left, and the coronal is this part, because you will be separating the front and the back, the transverse section naman is the horizontal plane, separates the body into upper and lower portion. So meaning to say, best example is a manananggal. Diba? Manananggal show the transverse section. So meaning to say, you will be eventually dividing or separating your upper part and your lower part. So that was the transverse section. So it's very easy to know the sections because it has a keyword. When we say coronal, separating the front and back. When we say sagittal, separating the right and left. When we say transverse, separating the upper and lower portion. Okay, so that is the section. So let me give you another illustration. So as you can see, like this, we have coronal, transverse, and sagittal. So yan. Nakikita nyo dyan. So you also can see the anterior part and posterior, the front part and the what do you call this? The front and back part. We also have superior and inferior, the outside and the inside part, and we also have the right and left. So as you can see, you can eventually know the different layers, the different position or location in this section. Okay? So, further examples or illustration. It is actually illustration na lang. So, yan. Nakikita nyo yan in the animals. How can you divide the human body into the transverse, to coronal, and to the sagittal? So, ganyan lang. Yan. So, sige daw. So, another checking of understanding. Sige. What is the section is in the letter A? Ito. Anong section ito? Ito muna, itong letter A, itong nauna. Then, what is the section for letter B? Then, what is the section for letter C? Okay? So, give me your answer in our GC. Okay? So, that was the checking of your understanding for the section. So, give me your answer in our GC, ha? Okay, so meaning to say I've reached the end of the slide. So this is the end of our discussion for this day. So thank you very much for listening. I hope that you listen to my pre-recorded discussion, not only in this one, because in general chemistry I also give you the first one. I hope you listen it carefully and understand and comprehend those terminology. And again, I hope you familiarize and memorize the body parts and areas, and including its location and position. So if there is no more question, or if you have a question, you can leave that in our GC, or you can direct message me for me to entertain you fastly. Okay? So see you on our next virtual class, and thank you very much for your listening. So have a nice day. God bless everyone. Stay safe. Bye.